The race is on now to help those left in the path of Hurricane Melissa, with entire communities in the tropics struggling to recover. Global aid groups are stepping in fast. One nonprofit group stepping in is a humanitarian organization, Direct Relief. With us now to talk more about it, Executive Advisor in the Caribbean, Ivonne Rodríguez-Wiewall. Welcome to the show.
Thank you. Nice for having me.
Absolutely. Ivonne, when we look at the scale of the disaster that has taken place down there in the Caribbean, in particular Jamaica, what is the overall picture of need right now?
There's devastation throughout Jamaica, Haiti, Cuba, infrastructure damages. In Jamaica, at least 4 hospitals suffered significant damages, which is reasons for serious concerns, as damages to healthcare infrastructure can have long-lasting impact in post-disaster settings. Experience has taught us that the primary cause of deaths during these events, like hurricanes, is not necessarily the impact of the hurricane, but what comes in the aftermath due to the lack of continuity of medical services. In Puerto Rico, for example, after Hurricane Maria, more than 4,600 people died because pharmacies were closed, health centers were without power, lack of services for people that suffer from chronic conditions, hypertension, diabetes. So,
yeah, you know, it's hard for people to get out. How do you guys get in, right? And then walk us through, you know, how do you guys direct where you send those resources?
Yeah, that's one of the biggest challenges right now. It's logistics, right? Ensuring that essential medical supplies and equipment reach the hardest hit areas as quickly as possible, especially where infrastructure and power remain compromised. Direct Relief, we just allocated $250,000 for emergency operations and logistics, and we already have $60 million in medical aid ready to be deployed. Today, I am going with some colleagues over to Miami, and we'll be in Jamaica tomorrow to continue conversations with the Ministry of Health, do the assessments of the needs, learn what is requested, and then be able to deploy those medicines and medical aid.
Is that what is in high demand the most? Is it the medical supplies?
Yeah, that's what our mission is. Our mission is to help better, improve the access to healthcare. So that's what we're focusing on: medical supplies, medicine, insulin, vaccines, wound care, assistance in preparation for responders. We already deployed backpacks for medical responders. We already have 250 hygiene kits for displaced people that are already on the way. And we have been working with Jamaica for the past couple of years, and we have maybe $3 million approximately in emergency preparedness projects in Jamaica alone, for solar power in medical warehouses, generators for health centers, mobile medical units that assist doctors go to the communities to continue the access to healthcare.
Yeah, what you guys are doing is so important, but it has to be challenging. Talk to me about the challenges to, once you get down in there, trying to get to those communities where power is still out and get those supplies where it's needed.
Yeah, the most important and the biggest challenge right now is the logistics. We need to ensure that the essential medical supplies and the equipment get as fast as we can. Our team is also navigating local transport capacity, which is challenging at the time as well, communication disruptions, and the need to coordinate with multiple partners as well. So we know that there's no duplication of efforts, and make sure aid goes where it's needed the most.
Yeah, we got months to go with this, right? What does real recovery look like to you in the months to come?
In our experience in Puerto Rico, it's been 8 years and we're still in recuperation mode. You know, power outages still very, the power grid is very fragile in Puerto Rico, so we have many power outages still. So so we know this is going to take months and up to years.
Okay, real quickly here, I got about 30 seconds left. How can people assist you? How can they help?
Direct Relief is a privately funded organization, so we depend on donations from individuals and private companies to continue our work. People can go to our website to get more information. It's directrelief.org, directrelief.org.
There it is. Ivonne Rodríguez-Wiewall, thanks so much for joining us. Really appreciate all that you're doing.